Patricia, you've been so tired lately. You barely eat, and you're always thirsty. Are you okay? I don't know, Mom. I thought it was just school stress, but my legs are swelling too. That's it. We're going to the doctor now. Let's go. Oh, my legs still hurt.
A few minutes later.
Slowly. Patricia, your research shows signs of chronic kidney disease. It's good you came early. Kidney disease? But I'm so young. What should we do now, doctor? CKD can affect anyone in the future, but we can prevent it. It often shows no symptoms until it's serious. Don't ignore the signs. Listen to your body. The early detection saves life.
Hi everyone, in this slide, we are going to dive in about chronic kidney disease, CKD. So, what is chronic kidney disease? Chronic kidney disease is a progressive condition where the kidneys are gradually lose their ability to perform vital functions such as filtering waste from blood and regulating blood pressure. When kidney failures occur, the kidneys can no longer remove harmful substances from the bloodstream, which may lead to a buildup of toxins which are dangerous to our body. The common symptoms include fatigue, swelling in the feet and ankles, changes in urination frequencies, and itchiness and dryness on skin.
Chronic kidney disease or CKD can affect anyone, but some people are at a higher risk. Common risk factors include diabetes, high blood pressure, and heart disease. Other important factors are obesity, being over the age of 60, and having a family history of CKD. A history of acute kidney injury, smoking, or tobacco use also increases the risk. CKD usually develops silently without symptoms in the early stages. It's often caused by a combination of health, lifestyle, and environmental factors. So, knowing your risk can really help with early detection and treatment. There are also several medical conditions that can lead to CKD. These include glomerular disease like glomerulonephritis, IgA nephropathy, and HIV nephropathy. Inherited conditions such as polycystic kidney disease and autoimmune disease like lupus nephritis are also causes. Severe infections such as sepsis or HUS, along with other problems like kidney stones, kidney cancer, frequent urinary tract infections, and birth defects of the urinary tract can also lead to CKD. These conditions can damage the kidney structures directly or cause inflammation, scarring, or blockage of all which reduce kidney function over time.
CKD. Introduction and symptoms. Chronic kidney disease, CKD, also known as chronic renal disease, is a long-standing, progressive, and usually permanent loss of kidney function that interferes with its ability to maintain fluid and electrolyte homeostasis. CKD is divided into 5 stages based on increasing severity. The mild form of the disease is called renal insufficiency, while the severe form is termed end-stage renal disease. There are multiple causes of CKD that can ultimately lead to end-stage renal disease and include diabetes, hypertension, anemia, renal bone disease, neuropathy, glomerulonephritis, inherited diseases such as polycystic kidney disease, autoimmune diseases like lupus, kidney stones, chronic kidney infection, prostate cancer, renal artery stenosis, etc.
There are several ways to cope with CKD. Some common treatments include dialysis, which filters waste from the blood when the kidneys can no longer do so. Second, kidney transplant, where a damaged kidney is replaced with a healthy one. Next, medication to manage symptoms and slow the progression of the disease. And the last one is proper diet, which is important to reduce strain on the kidneys and control related conditions like high blood pressures and diabetes. Next, there are 2 main types of dialysis. The first one is hemodialysis. This type uses a machine and a dialyzer filter. It is usually done in a hospital or dialysis center. Each session takes about 4 hours and it is done a few times a week. The second one is peritoneal dialysis. This one uses a special fluid called dialysate and usually done at home. It is quicker, taking only 20 to 30 minutes per session, and it is done every night at home. Now, let's take a look at the procedure of hemodialysis. This process is usually done 3 times a week. First, the patient blood is drawn out through a tube at a rate of about 200 to 400 ml per minute. The blood flows into the dialyzer, where it passes through a semi-permeable membrane. This membrane allows waste like urea, creatinine, and excess salts to be removed while keeping blood cells and proteins inside. Finally, the clean blood is returned to the patient's body.
Peritoneal dialysis is a treatment used to remove waste products and excess fluid from the body when the kidneys are no longer able to do so effectively. This procedure is performed through a catheter that is placed into a peritoneal cavity located in patient's abdomen. Here, the old dialysis solution is exchanged with a fresh one in 3 main steps. First step is drain. The used dialysis solution, which now contains waste materials and excess fluids filtered from the blood, is drained out of the abdominal cavity through the catheter. Step 2 is fill. Once the old solution has been completely removed, the peritoneal cavity is refilled with fresh dialysis solution through the same catheter. Step 3 is dwell. After the new solution is in place, the tubing and bags are removed. The patient is left with a short cape tube, allowing them to move around and go about daily activities. During the dwell period, the dialysis solution remains in the abdomen and absorbs waste products and excess fluid from the blood. This process helps maintain the body's chemical balance and remove harmful toxins, all in a way that can be managed from home in many cases.
For your information, CKD also can be prevented. There are several ways to prevent chronic kidney disease, such as managing diabetes and keeping blood sugar at recommended level, avoiding smoking, staying active with regular exercises, taking medicine as prescribed by your doctor, and also maintaining an ideal weight and avoiding obesity. All of this can help to protect your kidneys and promote a healthy lifestyle.
In conclusion, chronic kidney disease or CKD is a very serious condition where the kidneys slowly lose their ability to filter waste, often due to diabetes, high blood pressure, or poor lifestyle habits. When kidney function fails, dialysis is needed to remove waste from the blood. There are 2 main types, which is hemodialysis and peritoneal dialysis. Managing CKD early is key. This includes living a healthy lifestyle, controlling blood sugar and pressure, avoiding smoking, and following prescribed treatments to slow the disease.